So in talking with you in the past, I know that you really took issue with the excessive number of attachments that would be on cases you get from other aligner companies. And so I know you try to avoid that. Could you outline for us what some of the circumstances are where you would use an attachment?
Yeah. I guess when I was first using aligners, and I won't name the company, but they're the biggest one out there, I would get cases back that would have attachments on every single tooth. And it got to the point that I felt like I was using braces almost. And I feel like the patients were surprised. And I kind of did a knee-jerk reaction, and I went exact opposite way, where I'm like, I tried every case I could without any attachments, knowing that when aligners first started, they didn't have the concept of attachments, and I've settled into a nice medium, and I think that everyone I work with has too. Attachments, we try to avoid them as much as possible because they're uncomfortable for patients, and they're uncomfortable for dentists, and they take up chair time, but, they're a necessary evil, so to say, to finish on time. I think it's more important to finish without a lot of refinements and finish quickly than it is to take a long time and do a lot of refinements. And so, when would I use an attachment? I tend to put attachments on maxillary, lateral incisors if there's going to be any movement in them. If I have a severe crowding case on the bottom, I might put an attachment on either side of a tooth that I need to make room for. Just like a vertical, kind of two walls I can kind of push apart. I might put an angled attachment on some posterior teeth if I'm intruding lower incisors to keep the aligner attached. But they're minimal and they're well thought out. There's not a single attachment that is put on that isn't recognized that this is a burden to the patient and this is a burden to the dentist. So we really triple check them before we do that.